Health Authority, but the rollout is still facing obstacles with private facilities suspending SHA services for a week now as patients are forced to pay out of pocket. Now, the Ministry of Health, on the other hand, is decrying a huge financial gap, decrying a huge financial gap that is equally hindering the smooth implementation of SHA. Elizabeth Atieno with the details.
Since its rollout in October 2024, the implementation of the Social Health Authority SHA seems to be worsening with each passing month. Private and faith-based facilities under RUFA and CAF have since turned a cold shoulder to the insurance scheme, citing a 30 billion Kenya shillings debt from the defunct NHIF. The government, through the Ministry of Health, has acknowledged that it is indeed facing serious financial constraints in the rollout of SHA, largely attributed to the low number of Kenyans channeling their 2.75% monthly contributions to SHA.
The number that has taken means testing stands at 3.3 million, but the number registered is close to 19.4. So we really want to urge you to undertake the means testing process.
This means that over 14 million Kenyans registered for SHA are not remitting their SHA deductions. Additionally, there is no existing framework for means testing, which has also led to the low collection of contributions that are used to finance the Social Health Insurance Fund, SHIF.
The government has admitted that there is liability. I think we had the Cabinet Secretary yesterday in Senate saying that to the tune of 24 billion Kenya shillings. And liability is growing because we still have claims that are coming through the processing channel. In our own survey, about only 53% of hospitals have completed reconciliation. So we expect that this number will still keep growing.
The funding gap is wider in the primary healthcare fund, which has been allocated 6 billion Kenya shillings against the required 50 billion Kenya shillings, and the emergency chronic and critical illness fund, which has only received 4.1 billion Kenya shillings against the 75 billion Kenya shillings needed.
We are having 75 billion out of a 150 billion shillings budget being funded by global partners. Now, if you look that we have a 4.3 or 4.3 trillion budget, it's unfortunate that in a 4.3 trillion budget, all that we allocate to healthcare is 75 billion.
Funding is not the only impediment surrounding SHA. Health stakeholders argue that the SHA rollout was rushed and hence the government needs to re-strategize to ensure smooth delivery of accessible, quality and affordable healthcare.
Hospitals should be paid for the services they provide, but the measure of success should not be how fast they can pay. The measure of success should be this: as citizens, are Kenyans able to go into health facilities and get the services of an acceptable quality at an affordable cost? The answer to that question right now is no.
Health stakeholders also argue that the government has not heeded advice from health experts, which has led to the evident failure of the social health insurance scheme.
Citizens aren't able to get the services, so definitely it's clear that something is not working. The question that we are asking as members is, what do we need to do? As a country, sometimes it's important to bite the bullet and say, our intentions were good, but it has not turned out the way we expected. What needs to happen now is for us to go back to the drawing boards, look at what's not working and fix it.
In a bid to address some of these challenges, the Ministry of Health says the Benefits Package and Tariffs Advisory Panel has been instituted to review the benefits package within 2 years to ensure SHA services live up to the expectations of Kenyans.
Domiciled at the Center of Epidemiological Modeling and Analysis at the University of Nairobi, the panel will serve as a critical advisory body to guide decisions around the social health insurance program.
The intentions may have been good, and definitely NHIF needed to be reformed, but is this what we were expecting? The answer definitely is not.
So far, over 19.4 million Kenyans have registered under the Social Health Authority. Elizabeth Atieno, TV47, Nairobi.
Now, Nairobi